Alright, welcome back to another video for AP Psychology. In this video I've decided to put together a list of common confusing pairs. Now there are many versions of something like this on the internet. However, in this version I'm specifically focusing on common confusing pairs that affected my psychology students, and in this video it is more of an illustrated version. That way you can pair up both visuals with semantics. In doing this, it's my goal that you will be able to not only remember either the visual and or the meaning of these, but ultimately it will increase your memory capacity for hopefully remembering some of these confusing pairs. There is a reason why these are considered confusing pairs, and it is that some of them are very similar in nature in terms of the way they're structured or the way that they sound. So hopefully over the course of this video you'll have some insight into some of the vocabulary in AP Psychology which can be a little confusing. So let's go ahead and take a look at the first set. We have correlation and we have causation. Now, correlation generally implies that you are talking about an association between two things. Let's say X may be related to Y, whereas causation implies that one causes the other, whereas X causes Y. So it's really important to understand that correlation does not equal causation. This is very important when you think about possible FRQ topics, or even multiple choice questions. If they ask you in which research strategy would you expect to find correlation or causation, the causation would be found using the experimental research strategy, where the correlation would be found using the descriptive or correlational method. So be sure you're familiar with these terms. Next, in the biological basis of behavior unit, we have agonists versus antagonists. And these are really confusing pairs to describe the actions of chemicals that will resemble in mimicking or in blocking a neurotransmitter. So what you have first with the agonist is basically chemicals that are going to enhance cellular activity. What this means is that they're going to mimic your natural drugs. But then on the other hand you have antagonists, and antagonists is going to do the opposite. Antagonists will primarily block the cellular activity. What this means is that they are going to fill the receptor sites to prevent your actual neurotransmitter from being able to bond. In doing this, it would prevent you from having a neurotransmitter to bond at one of these receptor sites. And another part of the confusing pairs that many of you usually confused was the cerebellum versus the cerebrum. Now it is true both of these, as you can see in the picture, are parts of the brain, and each of these are equally important. However, they are not the same thing. The cerebrum is much larger in your brain than the cerebellum. The cerebellum is indicated on this picture as below the cerebrum, but it is generally in the back of the brain, slightly above the brainstem. The cerebellum in itself primarily focuses on dealing with balance and equilibrium, where the cerebrum is a lot more concerned with complex thinking, decision making. Pretty much thinking at all, it is isolated in the cerebrum. Be sure you don't confuse them. One has two L's and one does not. Another part of the confusing pairs was found under the organization of how our nervous system is routed. So we have afferent and efferent neurons. Afferent neurons are going to transmit information from your body to your brain. In doing this, your brain will then pass back a message that it will send via an efferent nerve fiber. So think about afferent with an A becoming before the E. It's going from the skin, muscles, and joints to the brain, passing along critical information. That way your brain can then respond by sending a message back to your muscles. The purpose of this would be, if your skin is placed on a hot plate, you're quickly going to detect this and pass along the message via afferent nerve fibers to your brain and spinal cord. The result is that your brain will quickly send a message back via an efferent nerve fiber to tell your muscle to move your hand. That way you don't burn yourself. It is a very important process as part of neurotransmission. You also have farsightedness and nearsightedness. So with farsightedness, you see fine far away, but up close you see poorly. A good phrase for remembering this is far away okay, near not today. For nearsightedness, on the other hand, it is just the opposite. Up close you see fine, but far away you will see poorly. A good phrase for remembering this one is near is clear, Far away, no way. Moving along, we have classic versus operant conditioning. Typically, classical conditioning is for involuntary behaviors, where are things such as phobias are going to be conditioned and acquired, or even taste aversion. If you have a food that makes you sick, or you have a wild plant that makes you sick, your body is designed to prevent you from wanting to eat this again, so you experience the taste aversion. You want to avoid this food so you don't get sick. Operant conditioning, on the other hand, is for voluntary behaviors. Using operant conditioning, you can train your friends, you can train a dog to do tricks, you can use shaping in order to get someone, as they are getting closer to mimicking the behavior you wish, you give them rewards. Speaking of operant conditioning, a lot of you struggled with negative reinforcement or negative punishment. So I just want to emphasize that reinforcement is designed to help increase behaviors, where punishment is designed to help reduce behaviors. So when you're using negative reinforcement, you're trying to remove something that is unpleasant and attempt to increase that behavior. For example, you have a lot of chores as a young student. Your parents may decide that if you keep your room clean, they will take away your extra chores. What they are removing is unpleasant. That is your extra chores. Negative punishment, on the other hand, would be if something pleasant to you gets removed in order to decrease your behavior. A good example of this would be if you are driving and hanging out with your friends one night, but you happen to stay out past your curfew. When you get home, your parents take your car keys. What they're doing here is removing something that you value, that would be your car keys, in an attempt to punish you so that you don't do this again in the future. Hopefully you'll learn your lesson. You can also take a look at the chart here overall to remind yourself about positive reinforcement and punishment as well. Next, we have the internal versus external locus of control. Basically, internal locus of control is a belief that you are in control of your own destiny, whereas the external locus of control is a belief that other people control your own destiny. Also, in regards to memories, we have proactive versus retroactive interference. This is one of the most commonly confused concepts through our AP Psychology class. When you have proactive interference, it means that old learning is interfering with new memories. If you have retroactive interference, it means that new learning interferes with your old memory. For example, for proactive interference, if you have known something from the past and you're trying to remember something new, that old information from the past may cause conflict in remembering new information. If you have retroactive interference, if you are learning new information, it may be very difficult to remember old information. Another confusing pair with memories is retrograde versus anterograde amnesia. A good example of this is thinking about the movie 50 First Dates, which you may or may not have watched in your AP Psychology class. Retrograde amnesia and anterograde amnesia are both types of organic amnesia that are a result of basically head trauma or injury. When you have retrograde amnesia, it means that you are waking up out of a coma, essentially with complete memory loss of your former identity. You don't know your favorite color, you don't know who you are, you have lost all memories prior to your injury. If you suffer anterograde amnesia, your memory loss is associated after the brain injury. This means that you generally no longer have a functioning short-term memory, which is critical for your ability to remember new memories and pass them through long-term memory storage. There are also types of memory tasks that can be confusing. Prospective memory tasks deal with your ability to remember to perform something in the future, maybe even a planned action. For example, if it's raining outside, are you going to remember to grab the umbrella so you don't get soaking wet? Whereas retrospective memory is going to be remembering past encounters or events. For example, on the AP exam, you're going to try really hard to remember all the things covered by your teachers in your AP Psychology class. There's also explicit versus implicit memories. What you're probably noticing here is that there are many confusing pairs for the memory-related unit. Explicit memories are pretty simple. It just means that you are talking about actual facts or experienced events, things that are relative to you or general knowledge. Implicit memory, on the other hand, is more of procedures. So do you know how to tie your shoes? Do you know how to ride a bike? These are procedural memories, and they are under the implicit memory category. You also have fluid and crystallized intelligence. Fluid intelligence is generally what you are born with. It's your reasoning abilities. It's your speed of information processing, your memory capacity. Whereas crystallized intelligence is going to be what you can learn and what you can do with the information that you've learned and acquired over the course of your life. So what I tell my students generally is that fluid intelligence will decline, but crystallized intelligence will harden. Think of a glass of water that's dumped out on the floor. Slowly that water is going to evaporate, albeit pretty slowly. That is your fluid intelligence. So your fluid intelligence skills are going to decrease over time. But your crystallized intelligence will constantly harden as the skills that you've acquired over the course of your life will allow you to solve endless amounts of problems and gain knowledge from that. There are also two distinctly different personality types that often can be confusing. You have a type A personality and a type B personality, which some of you may have been referred to by some people that you know. If you have been called type A personality, generally people are meaning that you are a competitive type of person. In regards to time, you have very little patience. You see things with a great sense of urgency. Occasionally, you may be more hostile and more aggressive. It's also worth noting that people who have type A personalities tend to deal with stress a lot more than the type B personality. And when you're stressed out, you typically run a greater risk of possible heart problems. The type B personality is basically the complete opposite. You're much more relaxed. You deal with just one thing at a time. You're much more patient, and time is not as much of an urgency. Type B personalities generally are less stressful. Two other personality traits that I often found many of you confused were the personality traits of neuroticism and psychoticism. Neuroticism belongs under the big 5 personality traits, which can be remembered through the terms canoe or ocean. And neuroticism is usually referring to negative type emotions. These are things like anxiousness, hostility, self-conscious, insecure, or vulnerability. As you can see, most of those are pretty negative emotions. Psychoticism, on the other hand, is a component of, of the big 3 personality traits that were under the hierarchy of traits according to Hans Eysenck. Hans Eysenck believed in gene influence on a person's personality, but psychoticism is generally referring to cold, impulsive, egocentric, or antisocial personality traits. As you would expect, many of those things are the traits that would make up someone who seems to be a sociopath or psychopath, specifically antisocial behavior. And finally, one of the last confusing pairs that I would like for you to see is dealing with obsessive-compulsive disorder. Now, many of you had a strong grasp of the different mental illnesses that we looked at. However, there was some confusion about the difference between obsessions and compulsions. So what I have for you here is basically obsessions categorized as recurrent thoughts. Compulsions, on the other hand, are going to be recurrent actions. Obsessions, as you can see, typically cause a lot of anxiety. The compulsions, on the other hand, are the way of relief. For example, someone might be very obsessed with the ideas of germs or constantly making themselves dirty or feeling unclean. They're obsessed with the idea of feeling unclean or that there are germs in their environment. That causes them anxiety, so in order to relieve that anxiety, they decide to chronically wash their hands. In doing this, they are giving themselves relief from the anxiety dealing with the germs. And that is all for my brief list of confusing terms. I hope that some of the illustrations here were insightful in a way of helping you think about the terms and visualizing the terms. Best of luck studying and preparing for the AP exam. It's not far away. Goodbye.